Hi, I'm Kristin. I'm going to be the nurse performing a head-to-toe physical exam. I'm going to first start off by gathering all my equipment, which I have here. I'm providing patient privacy, and I'm performing hand hygiene. So I'm going to first just look at her overall general appearance. She appears to have good hygiene, clean, her clothes aren't disheveled, she's dressed appropriately for the season. I am going to have you just kind of walk around a little bit in the room here. I'm just going to look at her gait, make sure there's no involuntary movements. Just go ahead and walk back and forth. Okay, good. I'm going to be looking at her skin throughout the exam. Her skin color, she's pink, she appears warm and dry. I'd be looking at pressure points, looking for any areas of redness, lesions, rashes, moles. I'm going to test her skin turgor. So you just do a little pinch underneath the clavicle, and the skin is a rapid recoil, so she is properly hydrated. I'm just kind of checking for any edema at all. Checking especially at the ankles, and I don't see any edema at this point in the exam. I'm gonna go ahead and look at your hands, and they feel pink and they're warm and dry. No open areas or anything. I'm looking at her nails, so I'm looking at the angle of her nails, and it appears to be about 160 degrees, no clubbing, checking capillary refill, and it's less than 3 seconds, which is appropriate. Pulses are strong and equal on both sides. For the next part of the exam, I'm just kind of observing her general mood. She appears calm, she's cooperative, she's alert and oriented, she answers questions appropriately, she makes good eye contact, her speech appears to be clear, not garbled at all. She appears to hear normal voice tones, she's not hard of hearing at all. I'm going to move on to inspecting the head. So what I'm going to do is I'm just palpating the scalp, feeling that everything is symmetrical, no areas of depression, no tenderness. Nothing's tender. Okay. I'm going to palpate the temporal arteries. And the pulse feels equal on both sides. I'm going to test your temporomandibular joint. I'm just going to have you kind of open and close your jaw. Okay, good. Let's see. And I'm going to go ahead and feel for your sinuses. Is there any pressure at all here?
No.
Or here?
No.
And that will conclude our head and face portion of the exam. Okay?
No. No.
Okay.
No.
Okay, good. And so you want, the middle to be about 90 degrees, the top to be about 50 degrees, and down about 70 degrees. So she did good on that side, and you would do the same with the other side. Okay, so just tell me when.
No. No. No.
Okay, good. The next part I'm going to do is the corneal light reflex. So what I'm going to do is I am just going to go ahead and have you look at me, and I'm just going to kind of shine a light in your eye. And what I'm looking for is the white spot of my light to be even on both sides. Which it is. Good. The next part is the red reflex, and so what I'm going to do is I'm going to shine the light in your eye, and I'm just checking for any opacities or anything in her eye, and so it's going to be a little bit bright, but okay, and I want to make sure I get the angle so that I can see the redness. Okay, good. Good. Okay. And I did not detect any opacities. The next part that I'm going to do is the 6 cardinal directions. So what I'm going to have you do is I'm just going to have you keep your head straight, and I'm going to have you follow my fingers. And so I'm just watching her eyes to make sure that they both move parallel, and as I hold it out, I'm going to look for any nystagmus or any, kind of tremors of the eye. Okay, so just follow my finger. Okay, good. The next part I'm going to do is called the cover test, and what I'm going to do is I'm going to cover each of your eyes, and I'm going to be looking for as I cover the eye and then uncover it, I'm going to look to see the response of the eye. So if the eye drifts at all, or seems like it's refixing, that could indicate muscle weakness in the eye. So I'm going to go ahead and cover your eye. Just look straight ahead. Okay, good. Okay, good. I did not detect any weakness. Then I'm just going to be looking at just the external structures of her eyes. I'm looking at the eyebrows. They look symmetrical. Eyelashes, I don't see any lesions anywhere. The sclera appear to be white and kind of glossy. I'm going to look at her conjunctiva, so just go ahead and open your eyes. I'm just looking at your... Okay, good, and there's a nice good pink color. I'm going to look at the corneas, and I'm just going to kind of shine a light, looking for any opacities at all. Good. I'm looking at the iris. They both appear brown. They're both brown and symmetrical. Her pupils look to be about maybe 4 millimeters in diameter. I'm going to look at do the Perla test. So I'm going to look to make sure that the pupils all equally react to light and accommodate. So I'm going to shine the light in your eyes. Just look straight at me. Good. Okay, and they both did react equally. And then what I'm going to have you do is I'm going to have you just look at me, look at my finger, and I'm going to have you look at a spot on the wall over here, and then I'm going to have you look back at my finger. So what I'm looking for is to see that her pupils constrict, dilate, and then constrict again. Good. Okay. And then I do not have a Snellen chart to complete for this exam, but I'll go ahead and explain how it would be done. So we would hang the chart on the wall, and I would have the patient stand at 20 feet away, and I would have the patient cover one eye, and then I would have them read the lowest line that they can read. And as they would read the line, I would check for any errors and make sure that the letters that they are reading are correct. And so then with that being said, you would check each eye, and the top number then would be 20 because they're standing at 20 feet. And then depending on the line that you read, there's a little number on the side, and that number will correspond to so you're standing at 20 feet and how far away, So for her, for example, her vision, she stated, was 20 over 200. So she can see the same thing at 20 feet away that somebody could see at 200 feet away. So that's kind of an example of how the Snellen chart works. And that concludes the eye exit portion of the exam. Thank you. Now I'm going to be conducting the ear and nose portion of the exam. So what I'm going to be doing first is looking at her ears and making sure there's no drainage or no lesions, no discharge, that the color is pink and feel warm and dry. So now I'm going to go ahead and look actually inside her ears, and I'm going to be looking at the canal, and then I'm going to be checking on the tympanic membrane of both ears. And so the tympanic membrane, we're looking for a nice white color. Redness may indicate an infection of some kind. Okay, good. Good, and they both look white. Then I'm going to be doing, it's called the whisper test. So what I'm going to do is I'm going to kind of occlude your ear on one side and whisper a 2-syllable word, and then I'm going to have you repeat that word. Okay? Apple. Okay. Baseball. Good. So the words that I said were apple and baseball, and she was able to repeat those back. The next portion is going to be the inspection of the nose. So again, I'm looking for symmetry. Her nose appears symmetrical. It doesn't look broken. I don't see any discharge, no drainage, no, doesn't appear, do you feel congested at all? No. Okay. So I'm going to actually go ahead and look inside of her nose. I'm going to be looking that the mucosa is nice and pink and that the septum's not deviated, and looking at the turbinates and making sure that everything looks a nice pink color. Okay. Looks good. I'm going to have you, I'm going to check the patency of her nose too. So what I'm going to have you do is just kind of occlude one side and sniff, and then you'll do the same on the other side. All right. And this concludes the ear and nose portion of the exam. For this portion of the exam, I'm going to be inspecting the mouth and throat. So what I'm going to be doing is shining a light kind of in your mouth and just inspecting all the aspects of the mouth. So I'm going to go ahead and have you open up. I'm looking at our buccal mucosa. Looks pink, no lesions. Her hard palate looks intact. Go ahead and lift up your tongue for me. Everything looks intact. Looking for any dental caries. It appears that she has all of her teeth, no missing teeth. No halitosis. Okay, go ahead and stick out your tongue. Okay, and her tongue looks midline as she does that. And go ahead and say ah. Okay. And so what I'm looking for there is that her uvula stays midline, and that it rises. And I'm also inspecting the tonsils, and it varies from 1+ to 4+, and hers appear to be just 1+. They appear normal. The last thing that I'm going to do is I'm going to go ahead and check gag reflex. So I'm going to stick this kind of in the back of your throat and just check for gag. Okay, go ahead and say ah. Good. Okay. And that concludes the mouth and throat portion of the exam. Now for this portion of the exam, I will be examining the neck. So what I'm going to be doing is I'm just looking for symmetry of the neck, feeling for any masses, any tenderness. I'm going to be looking at her carotid pulse. I don't see any jugular vein distension either. So I'm feeling for the pulse. You don't want to feel on both sides at the same time because it can block blood flow to the brain. You don't want to press too hard. And I feel like it's equal on both sides. I'm also going to go ahead and auscultate. With both the diaphragm and the bell. So I'm listening for a good stroke volume and listening for any bruise at all, and I did not hear any of that. Then I'm going to go ahead and palpate for lymph nodes. I'm going to just start here. Use the 2 or 3 fingers. You shouldn't normally feel any lymph nodes. If you do, you want them to be free and moving. I'm going to go ahead and kind of have you turn your head to one side to feel the deep lymph node. Then go ahead on the other side. Okay, back to the middle. And I didn't feel any lymph nodes. Some that would be concerning would be if they are firm and tender and not moving. Then I'm going to go ahead and palpate the trachea, just making sure that it's midline. Good. I'm going to go ahead and test your thyroid. So I'm going to kind of have you scooch a little bit this way. I'm going to use the posterior approach. And so I'm just going to kind of feel on your neck here. I'm feeling for the cricoid cartilage. I'm feeling for any masses or anything. I'm going to go ahead and have you swallow. Feeling that the isthmus moves up and down. Palpating the lobes. No tenderness?
No.
Okay, good. That's it for the trachea. Now I'm going to just kind of test your range of motion. So I want you to move your head up and down. Good. And side to side. Good. Okay. And I'm going to have you kind of try to resist my hands. Yep, good. And this way. And shoulders up. Good, good. Okay. And that concludes our neck portion of the exam. Again, just by looking for the rate and depth of her breathing, she doesn't appear to be breathing unlabored. The pattern is regular, depth is regular, does not appear to be in any distress. Looking to make sure that there's symmetrical expansion. So one of the tests I'm going to do, I'm going to kind of have you turn maybe a little bit this way, is I put my hands in the middle of her back, and then I'm going to have you take a big deep breath. Good. So what I'm watching for is to make sure that my hands expand equally, which they did, and that one side doesn't rise or fall more than the other. Another thing, I'm just going to be kind of palpating, making sure there's no tenderness, nothing's tender, no masses. Okay, another test that I'm going to do is called tactile fremitus, And what I'm going to do is I'm just going to place my hand on her back, and I'm going to have you say 99 each time that I move my hand, okay?
99, 99, 99, 99, 99, 99.
Good. So what I'm feeling for is that there's good vibration with her speaking, and I'm also going to percuss on her lung, her posterior lungs. So what I'm checking for is I'm just listening for a resonant sound. And whenever the sound changes from resonant to dull. Okay, good. Then I'm also going to go ahead and auscultate all fields. So I'm going to just go ahead and start with the posterior. So each time that I move my stethoscope, I'm just going to have you take a big deep breath, okay? You kind of hold your arms out like this. I'm going to kind of listen under your arms. Deep breath. Okay, and I'm going to have you turn back to the front. And same thing. Okay, and I'm going to have you just kind of lift up your breast tissue on each side. Deep breath. Good. And the other side. Okay, good. Another test that I'm going to do is called bronchophony. And what I'm going to do is I'm going to listen to her posterior lung sounds, and I'm going to have her say 99. And what I'm listening for is I don't want to hear her be able to say 99. If I can hear it clearly, that could indicate areas of consolidation in the lungs. So I'm going to kind of have you turn again on the... Okay, so I'm just going to have you go ahead and say 99.
99, 99, 99, 99.
Okay, and that concludes the lung part. I'm going to go ahead and listen to your heart as well. If you can, go ahead and turn back. Sorry.
Okay.
So I'm going to go ahead and listen to all the valves of the heart. I'm going to start with the aortic. This is the pulmonic. The tricuspid. And if you can lift up your breast tissue, I'm going to listen to the mitral. And so for the apical pulse, I'm just looking that it is strong and regular. Also listening for any murmurs, any bruits in the heart. Mostly making sure that everything appears regular. Listening for S1, S2 heart sounds. And same thing with the lungs. I'm also listening for you for clear breath sounds, not any adventitious sounds. Listening for crackles, wheezes, any coarse breath sounds, which I did not hear for her. Her lungs sounded clear. And her apical pulse was strong and regular. I'm also going to listen to all the valves again, the aortic, the pulmonic, the tricuspid, and the mitral valve with the bell of the stethoscope. Apical pulse, you want to make sure that you listen for a full minute to really be able to hear the regularity of the heartbeat. This concludes our midterm assessment for now. Thank you.